If you have sciatica, your first instinct is probably to pull, stretch, and move that leg to get some relief. And while that might feel good for a few minutes, there's a very real chance you're actually making the underlying problem worse. Today, I'm going to show you why your favorite stretches might actually be irritating your nerves further, and the one corrective shift you need to make if you actually want to fix the root cause and stop the sciatica leg pain from coming back. Keep watching. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario, Canada. Yes, I do prescribe stretches and exercise to my sciatica patients, and I have also many stretching videos here on my YouTube channel because they absolutely can help reduce pain, tension, and stiffness. But here's what many people don't understand. Temporary relief does not necessarily mean the underlying cause of the sciatica has actually been corrected. One of the biggest mistakes I see people make constantly is they stretch the painful leg without ever identifying what may be truly causing the contributing to sciatic nerve irritation in the first place. And if that root issue is never discovered and corrected, the pain often continues to return no matter how much stretching you do. In many cases, sciatica may be linked to underlying problems involving the spine and pelvis. These issues can place abnormal stress on the lower back and pelvis, the lumbar nerve roots, and the sciatic nerve itself, keeping the irritation cycle going and going and going. In a moment, I'm going to show you what to look for, how these hidden issues may be contributing to your sciatic, and why correcting them may be the missing piece to achieving more lasting relief from sciatica leg pain. Before I can show you how to correct the underlying problems contributing to sciatica leg pain for more lasting relief, I first need to walk you through how we actually evaluate and identify what may be causing the problem in the first place. As a chiropractor, one of my primary focuses is addressing the spinal alignment. This matters because the structure and alignment of your spine directly affects how stress, movement, and pressure are distributed throughout the entire spine. A healthy spine should appear straight when viewed from the front or back, and the spine is made up of 24 movable bones called vertebrae with discs sitting in between each of them. When viewed from the side, the spine should have some natural curves there to help absorb the force and distribute mechanical stress throughout the body. Although we evaluate the entire spine, the most important region when it comes to sciatic leg pain is the lower lumbar region, especially L4, L5, the sacrum and pelvis. The reason this area is so critical is because L4, L5, and S1 spinal nerves contribute directly to the sciatic nerve itself. That nerve then travels down through the pelvis, out the back of the thigh, and branches into the lower leg and foot. So when irritation develops around these lower level nerves, that is when symptoms can begin radiating all the way down the leg. The problem begins when the structural misalignment develops in this region of the spine. Misalignment involving L4, L5, and the sacrum can create abnormal stress on the surrounding discs, joints, ligaments, muscles, and spinal nerves. And over time, these problems remain uncorrected. That ongoing stress may contribute to annular tears, disc injuries, disc bulges, herniations, protrusion, even degenerative arthritis changes all the way through the spine. As these structural changes progress, they can begin irritating or compressing the L4, L5, and S1 nerve roots. And that is exactly what may be triggering your sciatica leg pain, the numbness, the tingling, the burning, or the pain traveling into your lower leg and foot. Here's what I find with many of the patients who walk through my door after suffering with sciatica for months or even years. They've never actually had a proper evaluation of the lumbar spine to assess for these underlying structural problems. And in many cases, that missing step is one of the main reasons why they continue to experience recurring sciatica leg pain despite stretching, exercising, and trying every temporary pain relief method they can find. This is exactly why the lower lumbar spine, sacrum, and pelvis need to be properly assessed when someone's dealing with sciatica. Because if the underlying structural problem is never identified and corrected, that irritation cycle continues underneath the surface even when stretching temporarily makes the leg feel better. And speaking of something that almost always goes undetected, if there's one more hidden imbalance that keeps sciatica coming back in so many people, and it has nothing to do with the spine directly. And this is the part that surprises most people because the particular problem is one of the most overlooked causes of chronic sciatica leg pain, and the vast majority of people suffering with sciatica have never even had it checked. It's called a leg length discrepancy. What that means is one leg is anatomically shorter than the other. Sometimes the difference is relatively small, maybe only 5, 6, or 7 millimeters. In other cases, it can be 10, 15, or even 20 millimeters. But here's what's important to understand. Once that discrepancy reaches more than about 5 millimeters, it can begin to create significant structural imbalance to the entire body, and that is when the problems really start. Your pelvis sits directly on top of your femurs at the hip joints. When both legs are equal in length, the pelvis remains balanced and level to the ground. But when one leg is shorter, the pelvis begins to tilt down on the side of the short leg. And remember, the sacrum sits between the two sides of the pelvis, while the spine sits on top of the sacrum. Together, this region forms what we call the lumbosacral pelvic region, and this entire region is now sitting on an unlevel foundation. When the pelvis becomes unlevel, the sacral base tilts with it. As a result, the lower spine begins shifting and leaning to one side to compensate. Over time, the weight and pressure of the entire body starts loading unevenly through the lumbar spine, particularly at the L4 and L5 disc levels. And those are the exact levels we just talked about, the ones that are directly connected to the sciatic nerve. That chronic uneven pressure may contribute to the increased disc stress, annular tears, disc bulges, disc herniations, and disc protrusions. And when that structural change begins to irritate or compress on the L5, L4, or S1 nerve roots, it can trigger sciatica leg pain traveling to the hip, thigh, and lower leg. The critical thing to understand here is that the leg length discrepancy is never identified and corrected. That mechanical stress on the spine and pelvis may continue building for years, completely underneath the surface. This is one of the core reasons some people keep experiencing recurring sciatica no matter how much stretching, exercising, or temporary pain relief they try. The foundation is off and nothing done above it will fully hold. In our office, evaluating for a leg length discrepancy is something we routinely do with our sciatica patients. We assess this using a thorough postural and clinical examination and commonly X-ray analysis as well. We do this so we can measure the imbalance accurately rather than guessing. And when appropriate, we correct the imbalance using properly measured lifts placed either inside or built onto the shoe to help level legs, pelvis, sacrum, and spine from the ground up. I also have several videos on my YouTube channel going into detail on how exactly we evaluate and correct leg length discrepancies, so make sure to check those out as well. When these structural imbalances are properly addressed, many patients experience significant improvements or resolution from the chronic sciatica leg pain because the underlying mechanical stress that was driving the nerve irritation is finally being corrected at the source. And that brings us to the bigger picture. How do we actually fix the problem at its root? Not just manage the symptoms temporarily. If you've been struggling with chronic sciatica leg pain for a long time, this part is especially important because this is where we talk about how we actually correct the underlying structural distortions that may be contributing to the nerve irritation instead of just chasing the symptoms around indefinitely. The primary method we use is chiropractic spinal adjustments. And the reason this matters so much is because as a chiropractor, our job is to identify the exact region where the structural misalignments are occurring within the spine, especially in the lower lumbar spine and sacrum region where the sciatica most commonly originates. When those distortions and misalignments are present, they need to be properly corrected, not just temporarily masked. We do this using specific, targeted chiropractic adjustments designed to improve the spinal alignment, restore motion, and reduce the abnormal stresses in building on the joints, discs, and nerves. What surprises many people is that these adjustments are gentle and they can often be performed safely even when someone's dealing with severe sciatica leg pain, an active flare-up, a disc injury, disc bulges, or herniations. The reason we can do this safely is because we first performed a thorough examination to determine whether the patient is an appropriate candidate for chiropractic care and what specific type of correction is actually needed. What we commonly find is that the spine begins stabilizing and the structural correction starts holding. The function and mobility of the spinal joints begin improving. At the same time, the irritation and inflammation surrounding the discs and spinal nerves can begin decreasing. The swelling settles down, pressure on the nerve roots reduces, and over time, the sciatic nerve irritation may begin resolving as well, which is when patients finally start noticing more lasting improvement instead of only temporary relief that fades within a day or two. This is the difference between correcting the problem and managing the problem. Over the years, we've helped hundreds of patients suffering from sciatica leg pain improve their mobility, reduce nerve irritation, and genuinely regain their quality of life through these specific chiropractic adjustments and corrective care approaches. But the chiropractic adjustments are only one part of the process. Depending on the patient and what our evaluation reveals, we may also incorporate properly measured foot lifts for leg length discrepancies, custom orthotics when necessary, specific exercises and stretches, and other corrective strategies to help stabilize the spine and pelvis long term. Because the goal is never just temporary pain relief, the goal is identifying and correcting the underlying structural problems that are contributing to the sciatica problem in the first place, so the problem stops coming back. If you've never been and had your lumbar spine, pelvis, or sacrum and leg lengths properly evaluated, and especially if the stretching and exercises are only giving you temporary or partial relief, for the pain returns, I strongly recommend finding a chiropractor trained in structural and spinal assessment. Identifying and correcting these underlying imbalances can make a major difference in finally resolving chronic sciatica leg pain for the long term. As you can see, truly relieving sciatica leg pain for good may involve much more than the stretches you find online. Stretches can definitely help, and they can reduce tension, ease discomfort, and give you some temporary relief. But for many patients, lasting improvement requires a more thorough exam and a proper structural analysis to determine what is actually driving the sciatica in the first place, and then a specific corrective plan to address it properly. That is exactly what I walked you through in this video. If you got value from this, make sure to like it and share it with someone you know who's dealing with sciatica leg pain. There are a lot of people out there struggling with recurring symptoms, and they keep stretching, they keep trying different exercises and stretches, and the pain keeps coming back. They may have no idea that the underlying spinal misalignments, pelvic imbalance, sacral distortion, or a leg length discrepancy may be contributing to the problem and preventing it from fully resolving. Subscribe to this channel if you want more videos focused on sciatica relief, spinal health, posture correction, chiropractic care, disc injuries, and long-term solutions that actually correct the root cause, not just temporarily mask symptoms. And if you want to go deeper on how we evaluate leg length discrepancies and correct for them using heel lifts and structural chiropractic care, watch this video next. I go into much more detail in the entire process, and I will show you exactly how it works, what we look for, and how correcting that imbalance can make a significant difference for chronic sciatica leg pain. So go watch this video next.